Okay, so this, I have registered you guys for an hour, but it will not take an hour to go through this. If you have questions and you are connected to the audio through your telephone, you should be able to ask that question. If you can't ask that question, you can do it through the questions box on the screen or through the chat box. I'll check them both when I'm done going through the presentation. And if all else fails, you can always give me a call or you can email me and I will answer your question. Like all of my trainings, I am going to record this training. I will send you some information about it after we are done. Okay, so October 1st of 2017 was the most recent data standards changes for HUD. These typically take place every year. They typically always take effect on October 1st. Any client entered after October 1st should reflect these changes, but there is no need to go back to clients who were served or entered before the 1st of October and make any changes. There are a couple of changes that review or that impact all programs. They are relatively minor, and we will go over those first. And then there are a couple of changes that impact permanent housing providers, which includes permanent supportive housing, single room occupancy like the YMCA, and any rental assistance, rapid rehousing programs as well. The first change in the system is regarding gender. They've updated the language around transgender options, and last year it was doesn't identify with male, female, or transgender, and this year it's gender non-conforming, not exclusively male or female. The transgender options used to be male to female, female to male, and they've updated that language to reflect trans female, MTF, or male to female, and trans male, FTM, or female to male. So when you are in the system now, after the 1st of October, you'll see that those changes are reflected when you are choosing a gender for your client. You will want to make sure moving forward that you are working off of assessments that end in 2017 and the parentheses York. I've loaded them for everyone. There should be no issues there. I'm going to try to go back and remove the old versions, but they should default to these options when you go into your entry exits or if you go into an update or an exit. If you are in an emergency shelter, you will see the SOESSH option. And if you're any other type of program, you'll see the all other projects option when you are doing your entry. There is a small change in the destination list for when you are exiting client. That change reflects that there previously wasn't a really good way to note that a client leaving your program was leaving your program because they were going to a rental that they had secured using a rapid rehousing program or a rental assistance program. So instead of just having the option of permanent housing for formerly homeless persons, there was also an option just for rental by client with no subsidy. We now have a couple of new options. The first one is that it's now called permanent housing other than rapid rehousing for formerly homeless persons. This would be things like a permanent supportive housing program, like Bell's York Apartments or Turning Point's apartments for persons with disabilities or permanent housing for persons with disabilities programs. It would also include places like the YMCA of York County. And then if they are leaving your program and they are getting some type of rental assistance, a rapid rehousing assistance, then you have the option now to choose that they are moving into a rental by client with an RRH, which of course stands for rapid rehousing, or equivalent subsidy. And those are your two new options on the list. Under non-cash benefits, they've removed Section 8, public housing or rental assistance, as well as temporary rental assistance from non-cash benefits. Those were very old line items and are no longer captured on the non-cash benefits screen. So your non-cash benefit screen has gotten a little bit shorter. There is a change to the disability screen that I think will make everyone very happy. Last year, whenever you would choose a disability on the HUD verification screen, it would give you a pop-up, and it was full of questions. And some of the questions you had to skip over because they were for path-only programs, and it was sort of a disaster. It was very hard to read. There were a lot of questions about what it meant to have documentation of the disability on file. Did the agency have to have it? Did their doctor have to have it? So HUD recognized that that screen was inconsistent and it was very confusing for a lot of providers. So they removed a lot of the questions. They removed the question about documentation of disability. They removed both of the questions that were for PATH-funded programs only. And they removed the question about whether or not the person was currently receiving services or treatment for their condition. So what that means is that your screen is much shorter and much easier to read now. You are still going to be asked if the disability is expected to be of long continued and indefinite duration and substantially impairs that person's ability to live. And you will still need to comment on whether or not the condition is going to be long-term, but you don't have to answer all of those other questions that were pretty confusing for a lot of people. Those were the changes that impact everyone. If you are a permanent housing provider, then these are the changes that also impact you. So as of last year, we had an entry date into the program, and traditionally the entry date was identified as the date the person was accepted into a program. And that was usually after all of their paperwork was completed. It was after their homeless verifications or income verifications had been submitted, and that they were like actively seeking housing. There was also on the entry and update assessments a question near the bottom that most people didn't fill in called residential move-in date. So they've changed the definition now for 2017 for what an entry date is, and they've changed the language around residential move-in date. Is called housing move-in date now, and both require responses. So what that means is entry date is no longer the date the person has completed all of their information to move into your program. The entry date now is at the date a person was admitted to the program. So HUD has defined admittance to a program as when information from the consumer or the referral source indicates that the person meets the criteria for the program. It's when the consumer has indicated that they want to be housed by your program. And it is assuming that the client is able to access services and housing through the program in a reasonably short amount of time if a unit isn't open already. So the third one doesn't apply terribly much to our community. That third one is a safeguard against wait lists. So what they're saying there is you don't want to start an entry date if you are putting someone on a wait list for your program. But the first two are important. The reason is that if a consumer has indicated they want to live in your housing, and they've indicated or the referral source has indicated that they meet the criteria, that's enough. You do not have to have the paperwork in hand for income. You do not have to have the homeless verification in hand to begin. You do not have to have their completed intake packet to begin. When you have said, okay, I'm going to move forward with filling out documentation for this person to look into housing them, that is your admittance date. So it is earlier than what most places have been recording. The housing move-in date is pretty simply the date the person actually moves into housing in your program. It's important to remember that admittance is not when you have all of the necessary documentation in place. It's when you decide to move forward with collecting that information. I don't want to beat a dead horse here, but it is a different idea, a different way of looking at things. The example I provide in my PowerPoint is if a program has permanent housing, but you have to be chronically homeless, and a consumer identifies on their own verbally that they have a disability and that they've been homeless for a long time. They think they've, been on the streets for over a year, for example. That is, and they tell you that they're interested in being housed in your program. That's enough information for an admittance date. So you don't have to prove any of those things at this point. So your screens will look relatively similar. When you do an entry-exit, you are still going to see an entry date. For those that run emergency shelter programs or transitional housing programs, this does not affect you. Your entry date has always been the first day the person stays with you in your program, and that is still the same for you. For permanent housing, permanent supportive housing, and rapid rehousing, this is now your admittance date, the date you start working with a person towards housing. At the bottom of the entry assessment, as well as the intake assessment, there is this housing move-in date that we discussed. Emergency shelter and transitional housing programs do not need to fill this in. Your entry date is still the only thing you need. But for the permanent housing providers, this is the date that you need to fill in when they move into housing. HUD had encouraged communities to include a local field to determine why people maybe didn't move into housing. So when you start an admittance process, but for whatever reason that person ends up not being housed in your program, maybe they actually weren't eligible, maybe they were no-shows on their appointments and you haven't heard from them. There's a whole host of things that could happen here. HUD would like you, or like us locally, to capture that information, but unfortunately HUD wasn't able to produce a question in time for the release of the data standards to ensure that that information was being collected across the board. So we are going to talk about that a little bit. When you are entering a housing move-in date for permanent housing, it does show up on your entry assessment, but the odds are that you will not know that housing move-in date at your admittance date. So you're not going to be able to fill that in on your entry assessment. In the rare occasion that someone was referred to your program, they completed their intake with all of their paperwork provided and moved into housing on the exact same day, then yes, you can put your housing move-in date on your entry assessment. But for the most part, there's going to be a gap between admittance or entry date and your housing move-in date. So what that means is I'd like you to do an update under the interims button on the entry exit tab to include this information. So I have screenshots showing you what that looks like, and we will walk through them a little bit here. So when a person is housed in your program, you'll come into Service Point, you'll open their client profile, you'll move to their entry exit tab, and you will locate your program. You'll see their entry date or their admittance date. And if you follow that line across, you'll see a button for interims. The button is actually supposed to resemble a piece of paper with check boxes on it. If you click that button, you'll get a little pop-up that'll ask you to add an interim review. You'll click the Add Interim Review button, and it'll ask you what type of review. Now, this is a drop-down, and it has several different types. It has a 30-day, a 60-day, a 90-day, a 120-day update. It also has an annual assessment, and it has an update. You will want to choose update. The review date will be the date that you put them into housing. When you save that information, it'll automatically take you into the COC ESG update screen. If you scroll to the bottom of that screen, and incidentally, that screen will be filled in. It will reflect the information that you collected on your entry assessment. But if you scroll down to the bottom, you'll see that housing move-in date, and you'll be able to type in the exact same date you typed in for your review. You'll type in their housing move-in date, the date they moved in. Once you've done that, you can save and exit, and you're done. This does beg the question for a lot of people, what happens if the consumer never reaches housing? So like I mentioned before, you start the admittance date, you start collecting information on the person, you start working towards a place where you can house them, and something happens. We will want you to leave the move-in date blank because you don't have a housing move-in date for that person. And you'll also want to exit them from the program, stating whatever the reason is that you ended up not assisting them with housing. But to prevent me from going back and contacting you later and asking you why your housing move-in date is blank and you saying, oh, because I never housed them, we've added a question locally that says reason housing move-in date is blank. And I've added a few suggestions to it, but if you have additional suggestions about why someone might not end up being housed through a housing program, I would appreciate those suggestions and I will add them. So the way I want you to handle this is at the point at which you determine that you are no longer moving forward with this client, you've decided they are not eligible or they have no-showed and you are going to close out their option for housing, I want you to go into that update assessment through the interim review, and I want you to put the review date reflecting the date you've made the decision to no longer move forward. You'll go into the update assessment and you'll go down to the bottom of the update screen and you'll see under housing move-in date that question about reason housing move-in date is blank. And I'd like you to make a choice from that drop down about why you didn't house that person. Once you've saved that information, then you can do a normal exit like you always would and state in the reason for leaving that you needs could not be met or, disagreement with the rules or whatever the appropriate choice is. And if you know where the client went, then you can also include destination. You'll see here there's a little screenshot of what that question looks like at the bottom of the update screen. Since I did this PowerPoint, I have gotten a couple of suggestions. So I've included, in addition to what's listed here, some language around going into institutional facilities. That could be a hospital, it could be jail or prison, it could be a substance abuse or a detox center, a psychiatric center, whatever that is. I've added language around those options as well. That's it. So the first few slides were pretty self-explanatory, things that affect everyone. The last few about entry date changes and housing move-in dates and updates, those only apply to those that have permanent housing or rapid rehousing programs. So for those that are on the call or typing in, does anybody have any questions? I'm going to give it just a minute and see if I get any. Okay, it looks like it's pretty quiet. I will send you out some information on this so that you have it for your records. And if you have any questions moving forward or you run into any unusual situations, don't hesitate to reach out and I will help you with that. Thanks everybody for attending. I appreciate it. Bye-bye.